huri kami kalau ota patient unna kama me orga doctor no penna
meetanun algon menna warar rangal hidmetta ke libe mungai
warang hinga je algon libun farwaya detere
දැන් ඩොක්ටර් අයිසාගේ වර රංගල ඩොක්ටර් එන බලන්නේ බොඩක් හම ඉන්සානියතට නිකන් කුරන්
algon fennani warang ufaluga immenves hidumet deta
Isaac doctor ke warar rangal warang hing he o gatere mi
Maldivian patients are very hardworking people. They do lot of manual laboring. They have lot of elements, ortho-related, which are very close to my specialty, which I am interested in treating. I really love to treat them with 100% success rate. They are very loving people, and majority of the people will listen to you, what you say. So I like them, and I am very glad to treat them. They get their problems solved in a very short time. They'll come, they are very happy with that, and they are very reciprocating in the sense they are very affectionate to us. So I'm really well connected with this Maldivian patient. My place is a bit far from the airport. I do agree that nearly 25 to 30 kilometers they have to travel from the Trivandrum airport. So if they contact me in advance, I'll arrange them the transport and everything with some hospital staff to receive them from the airport. Again, I'll put back them in the airport safely, because I don't want them to get fleeced on the way. I take a personal interest on that. That is number one. Second thing is, Marthatam is a place where you may not have entertainment place and things like that. It is mainly for the treatment. You have all the specialty, not only my specialty. There are a lot of specialties here. So they just come for 3 days or 5 days, get the treatment done, get satisfied, get cured, and they'll go back. My specialties are mainly spine surgery in orthopedics. Second is joint replacement surgery. Third is keyhole arthroscopic sports injuries. It could be a knee joint or a shoulder joint usually. This is then the plastic work and the hand surgery and the regular fractures and dislocations and things. These are the variety of departments which I have in my hospital. The specialty about Dr. Isaac Bone and Joint Specialty Hospital here is, it's a single specialty hospital. Like I am the doctor, I am the one who is going to see the patient right from the OPD till the end in different stages. Like I'll see the patient directly, I'll examine them, and I will make a professional diagnosis in the beginning to start with. Then I will order investigations accordingly. I will maybe if needed CT and MRI as well, and I'll coordinate with my clinical finding which I have seen when I examine the patient, and I will make a diagnosis. Then I will coordinate everything and I'll plan for surgery. I have a lot of doctors under me, but right from examination I do it. So that is one big advantage I think for any patient who really needs that coordination to get a real success. If you see the hospital outside, we never wasted any money unnecessarily here and there, making small every area air conditioner. But the prime area where it is required, I've gone to levels high actually. I've been to Germany and different countries. My work will be after my working time, I'll be watching each and every corner of the hospital. What is special in this hospital? What are the higher end equipments they have installed? How it is helpful to the patient's treatment part, like complications, how it reduces. Like that, my theatre is one of the prime area actually. It is a German technology actually. Right from this doors, it's a sliding door. to avoid turbulence inside the theater, infection rate. There I have three independent theaters. Mainly one is for only for spine surgery and joint replacements, and now no other surgery will be conducted there, because that much of cleanliness is very important to prevent these infections. Joint replacement surgery and spine surgery are the ultimate surgeries in the orthopedics. So where it is getting infected means it is very bad. So that area we have gone to levels high, and we have really taken care of. That is one thing. Second thing is we have operating microscope. That is also higher and call size microscope if you have. So we will be able to do with a small hole or small opening. We say it's a minimally invasive. We can do a lot of great works through that operating microscope. That also we have. And apart from that, we have lot of our OT table is totally different. You have a sliding on the table itself. There are so many adjustments are there, lights and everything, anesthesia equipments, everything we have taken care of. Each and every area it is. And image intensifiers, computerized image intensifiers we have. That is also highly loaded equipments. Another advancement which we do regularly here is spine surgery. Spine surgery, see, we are dealing with delicate nerves and spinal cords and all that. See, normally, once upon a time, we do it very carefully. Not only here, everywhere, they will do it very carefully. After the surgery only, we will come to know whether have we touched any nerves, any damage is already there or not. Only after the patient is out of anesthesia only. Now, we have a facility that is called neuro monitoring. The patient will be connected with the neuro monitoring equipment, and you have a laptop which will be instantly will be saying this nerve is getting compressed or pinched and everything. So we can correct it immediately. That is called, it's a great advantage of neuro monitoring. With that only we usually do this major spine surgery. So patients are very safe. They will not have any nerve injury, no nerve related issues are there. That is one big advantage in this hospital.
கன்னியாகுமரி மாவட்டம் குலசேகரத்தில் காதல் தகராறில் இரு கோஷ்டியினருக்கு இடையே நடந்த மோதலில் ஜார்ஜ் மற்றும் ஸ்டாலின் ஆகியோரது கைகள் துண்டிக்கப்பட்டன.
ஒரே நாளில் 2 ஆபரேஷன்ஸ், கை துண்டான ஆபரேஷன் செய்கிறது வந்து மருத்துவ உலகில் வந்து ஒரு அசாதாரணமான காரியம். வெரி சேலஞ்சிங் சர்ஜரி வாஸ் ஒன் amputation. Actually, in this level, actually, it was totally cut. You must have seen the pictures also there. This guy came to me actually, he came and told me, he never came to me for reuniting that actually, replantation. He said he was in a state of shock actually. He has already lost about 2 to 2.5 liters of blood and already wasted nearly 3 hours. He went to shuttle from one hospital to other hospital. They go there, they'll say, we will not touch this patient, you go to that hospital. Like that, by the time he reached me, he just held my hand and said, I just want to live, I don't want this hand, just please do something and arrest my bleeding and save me. So that was the request from the patient. But we went beyond that. I have done a fast examination and I found out it could be saved actually. So we didn't disclose that to the patient because his mentality was like that. He just want to get saved from the scenario. So we have resuscitated them with the blood and all those things fastly. We have revived him. Then I've given an option. If you accept all the complications, like because he is a sportsman actually, he is a bodybuilder also. So he should not have a heavy demand and all that because already he has wasted a lot of time and all that. But of course, I am very sure I can do a good job. I can do a good job and it will be it's not a hand getting united, surviving hand. Plus it should be a functional hand also. At least you should be able to do some job actually. That was there in my mind actually. So he also agreed. A lot of people from the village leaders and all, they have come and they spoke to me and all that. I explained to them and I have taken up for surgery. It went on for nearly 8 to 9 hours and finally you see how the hand is functioning right now. It has people from Chennai where the big hospitals are there, leading surgeons are working. From there, news media persons came and interviewed me also. So that was a very challenging. But another thing is, his brother, he also involved in the same incident. He was brought next day morning. He was in some place and his hand, that part was missing actually. And he came and asked me, by the time I came out from this theater, after finishing this surgery, his relatives came and there is another person is also there, can you do that? Already 12 hours is over. The golden time is 6 to 8 hours. Whatever you want to do, you should be done within that time. But I have taken a trial, that also survived. That is a very challenging. For that only media persons from Chennai and big cities had come there and really asked me this question. Usually big places like Chennai and all, they say, Chennai, Bangalore and all, they say it is only 6 hours you have to bring the hand. So we came to know that the hand was brought after 12 hours. That part was brought out. We have done a good job and that is also surveying. That is a very challenging case. I am also trained in plastic surgery. So we do the plastic work also. This particular patient you are talking about is a very scary picture. You can see all his teeth, everything, so that whole area, this whole area is gone actually. Actually, he was an electrician actually. He was working closely with the saw actually. So that time he lost his soft tissue from the face actually. He was in a medical college. The chief surgeon has advised them to do a plastic surgery. But thing is, they said you have to take a chunk of tissue from your chest and it will be converted to that area. So lifelong that deformity will be there and the hair loss will be there and the disfigurement will be there. You have to, and there is a big loss, soft tissue loss in your chest. So without shirt, it may be difficult to go out and all that. And this face also, that chest will come here, so that deformity will be there. Are you ready that? If you're ready, then we'll go ahead. So then they contacted me. So because I have already done a surgery in their family, so they contacted me and they came here. And the biggest thing is, when they finally came to me actually, my hospital actually. When they left the medical college, the main surgeon has told, see, you are going out from an institute where there are 350 doctors to a place where there is only one doctor. So you better decide on your own. That is the word that main doctor has told. Same thing they told me also. Of course, it was very scary to me, but still I had a very strong mind that it can be done. I have not taken any tissue from there. From there only, I have rotated the whole thing, and the final picture also you can see now. He is perfectly all right, and with a single sitting we have done it carefully. This hardworking fishing people, they do have lot of back pain and knee pain. This total knee replacement and the spine surgeries, which are my favorite specialties, they usually have back pain, low backache and the cervical spine and all. Cervical and lumbar area, these are the two main areas they get affected very frequently. I seen patients from young age till the adult, old age also, they have this spine issues. It may be a disc problem or a spinal canal stenosis where the spinal cord is getting compressed and all those things. That may be in cervical spine as well as in lumbar spine, 2 levels and all those things will be there. That is a number one problem. Second thing is they have knee pain, joint pain actually. Joint pain also, in the old patient, it is once again due to their age, degenerative changes and their profession, hardworking fishing profession. Another number of patients which I have noticed is sports individuals, like especially who are in their 20s and 30s and 35s, early third generations. They get a lot of sports injuries, especially for their shoulders and the knee joint and ligament injuries, dislocations and all those things. That is a very common thing which I have observed in this Maldivian patient. These are the common things apart from any other issues related to orthopedics. Mainly this spine surgery, spine related disc problems and the spinal canal stenosis, spondylolisthesis, that is one bone is slipping over the other. These are the main elements in spine related issues. These Maldivian patients are mostly prone for these spine injuries. Second is knee injuries, knee pain, hip pain, and shoulder pain, neck pain, and all that pain related arthritis cases. Actually, that is another thing. That majority of the patients will be a young patient. They are involved in sports and all those things. Otherwise, elderly patient, hardworking people with degenerated, age-related changes. These are the kind of patients they come. We have a separate desk for Maldivian patients. The way we speaking people, nurses are working people are there, and we have a separate second block for them so that they can be on their own. They can be free when they are in the hospital. They need not to get mingled with the local patients here. They can have because their lifestyle and this local people lifestyle is totally different. We have really taken care of. Then other thing is we have Asanda insurances there and INSPA. These are the main insurance companies we are tied up with. So whoever is eligible, we can do it free of without any money they have to pay here. Government will take care of that.
Algorithm Dr. Isaac born in Joint Hospital and I algorithm get elbow replacement, total elbow replacement surgery. Then algorithm mama get me masala hunata 20 plus years vedane algorithm we had was sedane and ekolum aine me bavel doctor una me kolum he algorithm na dekkize ekam Dr. Isaac waruge doctor ka timale nove then algorithm metana airuga me here nukurang asu doctor miha rangalwana kamka doctor ge team miha furihama vedana kamka but it exceeds the expectations. And algorithm methanang asura miyada hame they gave the utmost care the algorithm na hama varam muhimu bayage gotuka dekigen ekolum algorithm na me contact kore algorithm mamma ge atuke surgery ke vara complicated surgery ka vima me recovery rate was ehen befulunge kiban aduvun gotavure ma abaham mamma ge recovery rate was kosi.
When they speak itself, I'll understand what they talking about. I may not be able to talk in full sentence to them, but I will know now. By now, I know moment they start speaking only what is their complaint. Everything I will note down. Start writing only without getting translated. No need for a translator. I understand. Majority of them will speak English. Even otherwise also the way speaking people are with me, they will take care of it. And the expense part also. Usually I really consider their poverty and their difficulties and all that. So I will never try to fleece them in any form. What are the difficulties they have? I'll try to understand them and try to help them out to come out from that each and every situation. And so I'll have a personal touch with them. I will take a real personal care for them. Say for example, the joint replacement surgery. It is going up to $4,000 to $5,000 in places, even in India also. I don't blame them also, but I just charge just a half of the rate and I'll get it done for them, because majority of the patients are not affordable patients. You cannot sit in one corner and start ordering. You have to pay $4,000, $5,000 and all that. And again, for this knee ligament injuries, actually, usually they charge $3,000 to $3,500. Any ligament injury, just like that, for shoulder or knee or something, I usually charge $2,000 or something like that. I usually charge, and also the materials which I use, I never compromise, because whether I am charging more or less, the patient is my patient. I am responsible for the patient. If anything goes wrong, I cannot say that since you have paid less, I used this implant, that is the reason. I cannot say that is my responsibility. You should take it like if your own brother or your own sister or your daughter or your parents, what you do, the same thing should be done same thing should be delivered to the patient also. It is a service. Medical field, you cannot take it for granted. See, every day I have to make this much of surgeries and I have to earn this much of amount. There should be a give and take policy. You have to real poor patients, you can assess them. You can very well waive it down to the patient's satisfaction, and like that you have to do it. That is the affordability which I mean. You need not to worry about this financial commitments. That is one thing. We are very affordable. Like we just charge what we charge for the Indian patient. That is not much at all. That need not to worry about that. That is number one. This distance from the airport to this definitely will be taken care. And each and every corner, their food habits and are totally different. We understand that. Everything we have taken care. So need not to worry about that monetary wise or any issues. We will take care directly. So they can boldly come, get operated, stay for short stay for 2-3 days, and once it is over, they can go back.
Hospital ge horiha kantattake me warakin ham jehgoto horiha kamatiya doctor ge gaakama adi mitanu libbunu horiha khidmat hakiwes wara rangal khidmat take kama alun gabu kurani.
Thank you so much. Thank you, sir.